girls, welcome to e-learning of pharmacology and toxicology class. This is the part 3 of your analgesic and antipyretic chapter. In part 2 we had discussed regarding aspirin drug. So its indications, contraindications, its applicability, where it is used, when it is not used. Okay, so their combinations and all the things we had discussed, right? So in today's lecture we are going to see another one category from same topic. So today we are going to see paracetamol drug. So paracetamol is also known as acetaminophen. It is a medication used to treat pain and fever. So its category is analgesic and antipyretic. It is typically used for mild to moderate pain relief. Okay. Also, it is used in various forms of painkillers, anti-sickness medications. It is also an ingredient in a wide range of cold and flu remedies also. How it is work we are going to see. Nextly, mechanism of action. So mechanism of action of paracetamol is paracetamol has analgesic and antipyretic actions like aspirin, same as that of your aspirin drug. It has poor anti-inflammatory action. Anti-inflammatory, that means ki it is having the inflammatory response or anti-inflammatory inflammation reducing ability in comparison to aspirin, because it has weak inhibitory activity on cyclooxygenase enzyme. So our first drug, that means your aspirin, will having the high affinity or having the very high inhibitory activity on cyclooxygenase enzyme, which is responsible for producing the pain, right? So as compared to aspirin, the paracetamol is having the weak inhibitory activity, right? So its action is also less as that of your aspirin. Okay, so paracetamol is thought to relieve pain by reducing the production of prostaglandins in the brain and spinal cord. Okay, so paracetamol reduces fever by affecting an area of the brain that regulates our body temperature, the hypothalamic temperature regulating system or center. Okay, so our normal body temperature is 37 plus minus 2 degrees Celsius. How it will be regulated in our body? This is related with your hypothalamic temperature regulating center. Okay, so our drug our drug, that means your paracetamol, directly affect that area which is present in your brain. So it will command, okay, or it will directly act on that area, particular hypothalamic temperature regulating center, and it will show its antipyretic effect. So this is all about your mechanism of action. In short, I'll tell you, paracetamol seems to work by blocking chemical messengers, okay, in the brain, and that the messengers are messenger tell us we have the pain sensation. Okay, it directly blocked that chemical messengers. Okay, so it could not be it could not secret over there. Okay, so we couldn't feel any kind of pain over there. Paracetamol also reduces fever by affecting chemical messengers in an area of the brain that regulates body temperature. Okay, so now we'll see its dose. So paracetamol tablet, normally physician prescribe the dose is 500 milligram. Okay, and in syrup form somewhat less as compared to your tablet dosage form. That means ki normal dosage is paracetamol syrup 125 milligram per 5 ml. So uses of paracetamol, where it is used or where we are using this paracetamol. Firstly, it is used for fever. Okay, so paracetamol is used to provide temporary relief from fever without treating the underlying cause. Okay, we could not treat that, or we temporarily cause the relief, okay, to patient. Headache, paracetamol used to relieve acute headaches including migraine, and all the things. Muscle pain. So paracetamol is used to relieve mild to moderate pain in muscles. Okay, so that's why it is called as anti-inflammatory substance or drug. Menstrual cramp. This is fourth indication where your paracetamol is applicable. So paracetamol is used to relieve pain and cramping associated with menstrual cycle in women. So whenever any woman is suffering from any kind of uh, period or menstrual cycle, at that time she feel the same, she feel the pain, right? So for get rid of that pain, we need to give them paracetamol treatment or painkiller. Post immunization pyrexia. See, the word itself says that post immunization, that means ki after vaccination it is used. Okay, paracetamol is used in the treatment of pain and fever that sets in after one has taken vaccination. See, so many times we had seen ki whenever we are going for boosting or vaccination, after vaccination we are feeling increase in temperature of her body. Okay, what does that mean? Ki it's post immunization pyrexia. That medical term is called as post immunization pyrexia. So in that condition we are going to use this paracetamol as a treatment. Okay, this is normal one. Okay, so we are going to see its adverse drug reactions. So first of all, I'm going to tell you ki no particular kind of severe side effect is associated with paracetamol, but yes, if we are going to we are going to administer more than 500 milligram at at a single time, that time we can obviously obviously feel side effect of the same. Okay, so first adverse drug reaction is liver damage. So a paracetamol overdose is dangerous and capable of causing serious damage to the liver and kidneys. What will happen if paracetamol, we can administer paracetamol in larger dose? Okay, that time it can cause serious side effect to our liver and kidneys. So metabolic, these both are the metabolic metabolic organs, right? It will cause the metabolism of any kind of drug and all the things. So it will cause serious kinds of complications with both these organs, liver and kidneys. Next is allergic skin reactions. What will happen? Paracetamol can cause red spots on skin, rashes, hives, or itching. Okay, after its administration in overdosage. Okay, so next adverse drug reaction or ADR is anemia. So paracetamol can cause anemia like symptoms in some patients, like less oxygen carrying capacity and breathing problems and all the things, right? Vertigo and all kinds of problems associated with anemia, same symptoms, right? So next is Steven Johnson syndrome. First of all, I'll tell you what is meant by Steven Johnson syndrome. So this complication is rare serious disorder of the skin and mucous membrane. Okay, this is specifically a skin disorder. Okay, and what happened in that, a medical emergency, this is often a reaction to medication or an infection. Okay, so medication, that means yes, of course it is paracetamol drug. Flu like symptoms appear first. Okay, what will happen in Steven Johnson syndrome? A flu like symptoms appears firstly, painful rashes that spreads, and following by that rashes it will cause blisters also. Okay, so paracetamol can cause this rare but potentially fatal allergic reactions of the skin that requires immediate treatment. Okay, so see, next part is contraindication. I'm extremely sorry. Next part is contraindication. So contraindication in liver diseases. So paracetamol is metabolized by the liver itself and is not recommended if you are suffering from impaired liver function. Okay, if someone is having the if some patient are having the patient history like for liver diseases, that time we couldn't give them prescription or we couldn't prescribe them paracetamol, okay, because itself it is having the adverse drug reaction with your liver. NSAIDs, that means non-steroidal anti-inflammatory drugs. NSAIDs are most popularly used as painkiller and also anti-inflammatory agents. They do not contain steroidal ring in their chemical structure. That's why we called it as non-steroidal, right? So non-steroidal anti-inflammatory drugs. They should not be used for minor headache and fever. See, NSAID is mainly used for relieving the pain like osteoarthritis, rheumatoid arthritis, ankylosing spondylitis. This is related with your bones, lower back pain, migraine, gouty arthritis, menstrual pain, dysmenorrhea. It is related with menopause and all those things. Dysmenorrhea, again post-operative pain, muscle stiffness, again renal stone pain, dental pain, and tennis elbow and athlete injury. For all these kind of complications, or rather I can call it as diseases, we are using this NSAIDs. Mechanism of actions of NSAIDs. So NSAIDs inhibit cyclooxygenase, that means COX, and prostaglandin synthesis. These are the chemical what I can say, these are the chemical messengers which produces or which secretes in our brain so that we can sensitize that pain, okay. So these enzymes are responsible for formation of prostaglandin pgf2 alpha thromboxane, form the arachidonic acid. Okay, so I'll tell you what is meant by pgf2. It is one of the earliest discovered and most common prostaglandin. Okay, so it is actively biosynthesized in various organs of mammals, that means human beings, and exhibits variety of biological activities including contraction of pulmonary arteries and all those things. It is also used in medicine to induce labor and as an abortifacient. Okay, so this is also a chemical messenger. Next, inhibition of prostaglandin E, prostaglandin F2 alpha shows potent analgesic and anti-inflammatory action. So how they will act on your body? It will directly inhibit the synthesis or biosynthesis of cyclooxygenase and prostaglandin, so that we couldn't feel any kind of pain sensation. Next, therapeutic uses. So NSAID is mainly used for relieving the pain like osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, lower back pain, migraine, gouty arthritis, menstrual pain, dysmenorrhea, post-operative pain, muscle stiffness, renal stones pain, again dental pain, and tennis elbow and athlete injury. Okay, in part 4 of this chapter, we are going to see all these medical complications or all these medical terms. What does that mean? So we are wind up the session. Chalo, bye.